My daughter Zoe suffered a concussion at basketball nationals for under 18s competition. When we arrived at the hospital, I explained that she had had a very severe hit and that I thought she was concussed based on the answers that she was giving me to questions, the way she was talking about the accident, kind of just her whole behavior as she walked into the emergency room.
Concussion can be hard to identify, particularly if you don't know the kid prior to assessing them for concussion. It's important to talk to their parents or coaches or people that know them well and say, is this athlete or child behaving in a way that is different to how they would normally behave?
At that point, Zoe needed quiet, she needed rest, she needed very low stimulation.
It's very important after any concussion that we impose a strict rest regime, both in terms of everyday motor and sport, but also the complex tasks that the brain would have to do. Learning, reading, calculations, all of those types of tasks are very important. It's very important that we rest, give the brain an opportunity to recover and allow it to gradually come back to its former functioning.
Zoe returned to school after a week off and found it incredibly difficult to concentrate, found it very difficult to do any assessment, do any work, and was getting more and more frustrated. Actually kept saying to me, I'm getting worse, I'm not getting better.
I think it's important to recognise that when students return to school from a concussion, that regardless of how serious or minor the concussion is, it's treated as serious. It's important to have a relationship with the parents to find out what the medical practitioner has advised for that child and make necessary adjustments for that child to return to learn.
So 4 months after the initial incident, Zoe returned to school, but just half days. And all she was allowed to do was sit in class. She wasn't even allowed to take notes. The specialist explained to us that she would have a hard time seeing what was on the board, having it input into her brain, and then pour it out through her hands. So that was too much effort still, after 4 months, for Zoe to be able to do that.
Some of the adjustments that we can make for children that are returning to school after a concussion is obviously depending on the medical practitioner's advice, but for some children who return after a concussion, they might be a little bit sensitive to hearing, particularly when there's a big assembly and there's a lot of noise in the one room. If it's a screen activity, it's important that they're having regular breaks throughout the day. Sometimes teachers are needing more clarification around what strategies to use, and when they're unsure of what to do, it's important that they know when in doubt to sit the child out.
She followed that program of kind of part-time days for about a month, and then 5 months after the initial event, she actually was able to return to school full-time.
The Concussion in Sport website is a very valuable tool for all educators. I think going through the website, it provides some excellent fact sheets for teachers and parents to actually read through to gain that professional development around how serious concussion is.
This whole experience has taught me a couple of things as a parent. One is follow your intuition. You know your kid better than any doctor or any coach or any physiotherapist. You know when they've had something happen to them. And secondly, brains are too important for the rest of their lives to be messing with. So rest their brains, give them time. Just give them time for sport, give them time before you send them back to school.